कैंसर नाम सुन के ही डर लगता है ना. बट इफ आई टेल यू वन ऑफ द कॉमनेस्ट गायनेकोलॉजिकल कैंसर इज प्रिवेंटेबल, देन हाई, आई एम डॉक्टर अबोली चांडगे, senior consultant obstetrician and gynecologist, Mom Story. So we are going to discuss about cervical cancer. Cervix is the lower portion of uterus, जिसे हम यूट्रस का माउथ भी बोलते हैं. Cervical cancer is one of the commonest cancer in women all over the world, and the mortality rate is also high. Why? Because the cervical cancer usually is not detected in time, probably because of the vague symptoms it has. The symptoms can be unusual white discharge, intermenstrual bleeding, bleeding after intercourse, postmenopausal bleeding, or sometimes adds ordinary symptoms like bloating, constipation, etc. Now, nobody will think that they are having cervical cancer if they have such symptoms. That's why for early detection of cervical cancer, there are some screening tests, and for prevention, there is a vaccination available. The important screening tests for cervical cancer are Pap smear test and HPV DNA detection test. The Pap smear test is done by internal checkup, where we use a brush to scrape the cells on the cervix, and the cells are seen under microscope to look for any cellular changes that can happen way earlier than the development of cervical cancer. The Pap smear test should be done by everyone after 21 years of age if they are sexually active, or after 30 years of age irrespective of sexual activity. The test has to be repeated every 3 years. The other screening test is HPV DNA detection test. Now this HPV, that is human papilloma virus, is a virus that can affect cervix and can lead to cervical cancer. The human papilloma virus detection test can be combined with the Pap smear test when we call it a combined screening. So if you are opting for a combined screening, then the test has to be repeated every 5 years. Now this human papilloma virus, it doesn't only cause cervical cancer and stop there. It can also lead to anal cancer, penile cancer in boys, oral and pharyngeal cancers, precancerous lesions, genital warts, etc. So there is a vaccine against HPV, that is human papilloma virus. Now as we know, viruses have different strains, just like we have seen in COVID and flu viruses. So this human papilloma virus has more than 100 types. Now some of the types like 6, 11, 16, 18, 45, etc. we call them high risk types of HPV, meaning the infection by these strains can increase the chances of cervical cancer. So the vaccines are basically targeted against these high risk strains. Now we have 3 types of vaccines available against cervical cancer. Most important is the Gardasil vaccine, which is available in market since almost 15 years now. Gardasil comes in 2 types: quadrivalent, which is against 4 strains of HPV, and nanovalent, which is against 9 strains of HPV. The schedule varies as per the patient age. The vaccine can be given 9 years onwards. 9 to 14 years, only 2 doses are sufficient, given 6 months apart. And 14 years onwards, you will need 3 doses, 0 dose, then another dose after 1 or 2 months, and third dose after 6 months. Another type of vaccine we have available, that is developed by our own Serum Institute of India, that is Cervavac. It is also a quadrivalent vaccine, and it can be given from 9 years till 26 years of age. It also needs 2 doses from 9 to 14 and 3 doses after 14 years of age. So like I said, if you opt for HPV vaccination, it will give you protection against cervical cancer as well as other precancerous lesions and other cancers like anal, oropharyngeal and penile cancers. The vaccine is recommended for boys and girls as well. Recently, Government of India has approved Gardasil quadrivalent vaccine for teenage girls. So if someone takes the HPV vaccine, then there is no need for screening test? No, it's not like that. The vaccine will protect you against the cervical cancer that is caused by infection of HPV viruses. But there are other types of cervical cancers as well. So, pap smear test is still needed even after taking HPV vaccine and should be taken every 3 years. So, if you have any queries regarding cervical cancer or vaccination, kindly visit Mom Story. Thank you.